So today I want to go over two concepts with you that I've gone over in the past. The first of which being 15 days to slow the spread. 15 days to slow the spread of obesity. 3 things you can do to try to slow the spread of obesity. If you think that your weight is beyond your control, do this for 15 days and then get back to me. For 15 days, focus on getting quality sleep. Spend 30 minutes a day for 15 days trying to assure that you get the best sleep possible. Try to make sure the room temperature is correct. Make sure that you feel good. Take a shower. Make sure the pillows are right. Make sure the sheets are right. 15 days, at least 6 hours, trying to get 8 hours of sleep uninterrupted, okay? 15 days of you taking your body weight in pounds, dividing it in half, and those are the ounces of water minimum you take in for 15 days. For 15 days, spend 30 minutes a day dedicated to just stress relief, just making yourself laugh, just doing anything you can to try to relieve stress. For 15 days, 30 minutes a day of consistent activity. I don't care if it's cleaning your house vigorously or taking a walk vigorously or working out really hard vigorously, but for 15 days, 30 minutes a day, every single time, activity, 30 minutes straight. And for 15 days, not eating any processed carbohydrates or any processed sugar of any kind. If you can't accomplish these things for 15 days, how dedicated are you to your own personal health? And that leads me to my other point that I wanted to go past. We do not have healthcare in America. And many people can freak out about that, but speaking as somebody that worked as a multi-unit healthcare executive for well over a decade, I can tell you that the system is designed around fleecing people of money because they don't even give you the prices on most of that stuff, and treating your sickness. It's not preventative healthcare. Preventative healthcare would be the healthcare system trying to make sure that you eat correctly, that you drink enough fluid, that you take care of your body, that you get enough stress relief, that you get enough sleep, enough hydration. That's healthcare. That is caring for your health. Caring for your health is making sure you do not eat in a fashion that's going to make you morbidly obese. Caring for your health would be eating in a fashion to try to avoid type 2 diabetes. 35% of all cases of cancer are avoidable by lifestyle changes. 50% of all strokes, 80% of all cardiovascular disease is avoidable. If we actually had health care, we wouldn't be talking about 90 percentile of a chronic illness that is devastating American society being avoidable. That's the thing. 90% of all type 2 diabetes cases, 80% of all cardiovascular disease, 50% of all strokes, and 35% of all cases of cancer are avoidable by lifestyle changes. If we actually had health care, that wouldn't be the case because those things wouldn't be in existence because we'd be caring for people's health. We wouldn't be letting them get sick. But we don't have a society like that right now. We have a Sickcare society. Like when you've eaten yourself into type 2 diabetes, which is, again, 90% of you, and then you go to the doctor and they give you metformin, that is not health care. That is sick care. They are treating your sickness. It is your responsibility to try to stay as healthy as possible. And I can say this because we clearly in 2020 decided it was everybody's responsibility to keep everybody healthy. So if that's the case, and because I don't want to see you devastate your life and destroy your health, as many other people don't, you should try to be healthy. You should try your own health care and have it be preventative so you don't have to then access the Sickcare system. You see how that works? But instead, we don't look at it that way. Everybody wants to have very little responsibility for the actions of their lives. People do not want to fess up to when you've eaten yourself to 300 pounds, you're going to have loose skin. You're going to have osteoarthritis, and you're going to have other chronic diseases and disorders if you stay there. It's going to happen. We look at these things as unfortunate things that have happened to us. No, you did them to yourself. It is self-responsibility of your own health. That is true health care. That is what the healthcare system actually is. Us taking care of our own health because we are in a society, and a strong society is made up of healthy people, not people that take care of each other when they're sick only. That, I'm letting you know, I find it immoral. After being in the healthcare system for over a decade, I can tell you one of the reasons why I left is that people get jaded. It's all money and numbers in the healthcare system. It's about the daily census. I walked in on way too many morning meetings where a nursing home administrator was informed of unfortunate deaths of somebody's loved one overnight, and the first question they ask is whether it was before or after midnight, because if it was after midnight, they go on the census for the next day and they get to charge the healthcare insurance for that day. And it happens almost in every nursing home, every skilled facility I've ever been in, where the people that run it, the healthcare system operators, end up focusing more on the numbers, the financially driven numbers, than they do the actual care of people's health. We have people on 7, 8, 9 medications, 3 or 4 of which are to just counteract the side effects of the first medications, when in fact, if we just had the person try to stay healthy, they would be on none. Like, this is the sick care system that we need to combat in America. Now, I know that I put stuff across in a very blunt and unfortunately harsh term for most of you, because all of you are in your feelings so much. You're in your feelings because you know it's you. You're in your feelings because somebody that just states literal fact about health can upset you so much. I can upset you so much with sheer facts. That should be the telling factor that it is you. You know it's you. You just need to get there faster. Get some counseling. We should definitely, if we wanted an actual healthcare system, mental health counseling, especially after 2020, should be just given out like candy at Halloween. You see what I did there? We give out unhealthy shit. Maybe we should start giving out healthy shit. We should encourage everybody to get counseling. Everybody. I don't think there's a person alive right now in the United States that doesn't need some fucking counseling after 2020, after all the shit we've done to each other. We should do that. We should encourage everybody to actually be active. We should encourage these companies that are taking advantage by, well, we now have plus size clothes. Nike, Adidas, all these places. I'm very happy that you're making plus size clothing so obese people can have stuff to wear, to work out in. You know it's just about the money for these people. Again, I'll tell you why. And a lot of people don't see it this way, but I actually work with morbidly obese people on a daily basis. All these clothing companies, they're not worried about your health either. They're still just worried about money. And here's how you tell. For a morbidly obese person, finding shoe wear that fits is tantamountly important, because there's some sort of insulin resistance almost in every single super morbidly obese person. Like if you're a 400-pound motherfucker, you've got some sort of insulin resistance going on. And if not, you're likely to have some. So foot care and making sure you don't get sores on your feet is incredibly important. It's important for anybody because it can hurt somebody's training, it can be painful, and it can lead to further problems. But for a morbidly obese person, especially somebody that's pre-diabetic or type 2 diabetes, that can take their foot off. It's just fact. It just happens, and it's going to happen lots and lots and lots more. But yet these companies don't make shoes fitted for morbidly obese people whose feet are inherently wider and taller because they have fat on them. So instead, we leave it to a morbidly obese person to have to buy an ill-fitting shoe, and then the fitness industry fuckheads tell the person that they need to run and or do all sorts of shit on their feet all the time. So now they're wearing ill-fitting shoes, probably 3 or 4 sizes too big for them, and then they stuff them because their foot is so fat and so tall that it causes sores on their feet, and then they can't work out for a week at the very least. If not, they have to go to the doctor to make sure that the foot sore that they have from wearing ill-fitted shoes is not going to result in the loss of their foot. It's all a farce. The healthcare system caring about your health, that's a farce. That's a sick care system. These companies that are talking to you about like, well, look, you can look great while working out, but not addressing actually everything you need to wear, they're just tagging on. Do you understand that? Like, they are tagging on. I need a shoe wear company to go out there, and they can contact me if they're wondering the advice. I need a shoe care company to make it so we have a wide, tall model of shoe so a morbidly obese person can actually be functioning in it. They can actually wear it to attain health. We need actual real steps taken, not just efforts on companies to fleece obese people, including the healthcare industry, and not these fat acceptance, fat activist weirdos that are saying that you can be 400 pounds and healthy, apparently, as long as you dye your hair and wear glitter all over yourself. Like, that's the issue. We just need to enter reality. We do not have health care. We have sick care. If you want health care, we need to actually start taking care of our health. It is our responsibility. I suggest you join me in doing so. God damn.